Mazik Vaccine Flow is an integrated platform built on Microsoft Power App technology, which allows you to deliver vaccination at scale. There are three key areas which we are focusing on as part of Vaccine Flow are the vaccine administrator, which allows them to make sure that they have the right amount of inventories, they were able to schedule their appointments effectively, and they're able to have a full track and traceability around vaccination. We're also focusing on employees. So employees can go and using a portal be able to make a self-service appointment based on their availability and the location closer to them. And then we are also focusing on patients. If you want to allow them to make an appointment through a self-service portal instead of calling your call center and make those appointments. So these are the three key areas or three key personas which we are focusing on. But if I try to explain same of these three persona from the features perspective, the first feature which we are focusing on is around the eligibility and scheduling. So as you're aware, CDC is defined phase 1, phase 2, phase 3, but every hospital is kind of defining phase 1A, phase 1B, phase 1C, depending upon the number of vaccines they are getting, understanding the age of their employee, comorbidity, and other things to ensure that they can prioritize the employees who need to get vaccinated first. So we kind of provide the capability there. Then there are areas where we are doing vaccination appointment and administration, and this is where an employee or patient can come to a web portal and make an appointment based on their availability, based on vaccination availability, and based on the location closest to them. And once employee make an appointment, they typically get a text confirming their appointment with a lot more detail and a QR code. So when they go for administration of vaccination, you don't have to enter and find the employee. You can just scan the QR code to make it happen. Similarly, as the person who is administering the vaccine, they will be able to use a phone app not only to identify the patient appointment using the QR code, but been able to assign a serial number of the vaccine which is going to get delivered through the same QR code scanning. So you can connect an employee or a patient with the vaccine which was delivered, and you have a full traceability. The third area which we are focusing on is around vaccination outcome monitoring, or in general we call it adverse reaction. But the solution we are providing either for employee or to patient to go and make either report a symptom or be able to report an adverse reaction, date of adverse reaction, and all the details around it. So your organization you can react to it as a case and manage that case, or you can report it back to the state or for pharmacovigilance purposes. The fourth area which we are focusing on is vaccine inventory management. And that's like two areas. One is a full capability where we give you demand planning, we give you a warehouse management, we give you transportation management, and everything to manage an effective supply of vaccination within your network. Or there is a basic capability on inventory management we are doing where we're able to help you track the point you receive a vaccination to the point that it get delivered. So if you receive them to central supply, then you move them to two different locations, at what time it was in transit, for how long it was in transit, what was the storage type, whether it's an ambient or it's a cold chain. And if you move it from one floor to another, when did you take it out from the cold chain to an ambient temperature? Because then it helps you define which inventory is on what shelf life or when is it expiring. Because remember, if you continue to keep in a cold chain, the expiry is higher. But if you move that same vaccine and keep it in an ambient temperature, then its expiry is not going to be more than 3 to 5 days. So we kind of need to make sure that we are managing those details. And the fifth core thing is around the health command center. So we are providing two kind of scenarios where one is focusing more on the transactional system. And then we have a Power BI capability which can give you the volume and how many population have you served in different situations around it. So that's kind of a high level of different solution capability that we are delivering. if we look into specific scenarios, so for example, Jenny Smith, who is a staff nurse, an employee, and she's planning to make an appointment at this location. So she can go into a website, open her laptop, and enter this information through it. So I'm going to switch to my the web portal, where you can see that it's branded right now as Mazik, but every hospital can brand it like their own website. So that's the default capability available. As an employee, you can just go in, click sign in, and what it means is that once you sign in, you provide your username, and we know who the employee is. But if you are a contract worker and you don't have an AD, you can also go make an appointment and work through it. But you also can report a reaction from here. You can check your eligibility for vaccination. If you want to find a specific provider, you can go find that too. So I'm going to start with making an appointment. And as you see, means it's a straightforward basic information that we're capturing for patient. So for example, if I pick up James Baldwin 3 is the patient, I enter the date of birth, I enter the basic information. We need a special accommodation of wheelchair, so we track that. The addresses were defaulted up here. Then we go in and we have updated the race and ethnicity. So remember, in a general vaccination registry, states are not requiring to report race and ethnicity, but for COVID-19 vaccine, states are requiring. And I'm pretty sure that as we move into that phase, there are more data will come. And this is where the power of this system comes, where you can add as many attributes during each of these processes and flows. So I submit this information. The next thing is going to ask me, since this is the first time I am on this website, it is asking if this is my first dose or second dose. Remember, you can actually have doses from different places, but you just need to track so we can push that information to the state registry that was it a second or a first dose. So if it is a second dose, then automatically you have to provide that additional information, where did you vaccinate it and all of those details, so we can, which date it was administered, so we have that information. But since in our scenario is the first dose, I'm going to select the first dose and submit this information. Once I submit that, the next thing it runs into is to kind of walk me through an eligibility check. And I've configured the base CDC based guideline on the eligibility for phase 1A. But you can configure as the phase changes or as the guideline changes, you can completely reconfigure these questions. So for example, do you work in healthcare? Yes. And based on my responses, I'm going to get qualified that if I can get an appointment for the phase 1, or do I need to get into a wait list. So for example, if I enter emergency and law enforcement personnel, I have defined a comorbidity. I'm trying to make it more complex so we get selected for the phase 1. So I have a COPD 2, I'm not pregnant, and then we submit this information. So the next thing it is that allow you to take a consent, and you can do more than one consent. In just this demo purpose, I put some standard legal language, but it will be up to you what consent that you want to put in. So you have the consent associated with the terms and condition available here. If the employee who you have sent to make an appointment, if they decided to actually not agree, which means they're refusing the vaccine, they can actually refuse the vaccine, and this way you can track who are the employees who are refusing, so you have the full details. So I'm going to submit. It will show you the list of all of the locations which are close by based on the address you have entered, and also number of appointments each of the clinic have. If we see the first one where we have 200 appointments available, I click on AirDial Mobile Clinic. It gives me options of different available slots available, or either for today, or I can look into the next available day too. There are two ways of implementation we are doing. In one way, we are providing a full detail searching capability where employees can search, means that I need an appointment on a Wednesday between 9 a.m. to 11. Or a lot of organizations are focused which give you the restricted slot to make sure that I can fill my day 1 appointment before I try to fill my day 2 appointment on, and also the vaccination availability and everything. So I'm going to pick the first one. When I click on booking, it confirms the information for me, the patient name and other detail, the start time and everything. And when I click on book, That's where it actually create a confirmation. And this is where what you will see is that I have a confirmation ID with the information. I can just print it. I'm also going to receive an email, and I'm also going to receive a text message from the system. So it gives me the reminder, it gives me all the related information up here. So now I'm going to switch into back to my presentation slide, where we were able to get Jenny Smith registered for an appointment. Now there are two views, one that the clinical staff can see in this dashboard view, how many appointments are in pending status or schedule or wait list, so you can do the wait list management from here. Or we also provide a mobile option, so if you are a person who are administering the clinic, you will be able to have access to a mobile interface where you can select which mobile location you are in and then administer clinic. Let me switch into my my cell phone to show that aspect of the application. So before we get into the vaccination administration, there's one thing I want to cover. This is with the text message that I've received with my QR code. It also has the information of the location where this appointment is scheduled, a driving direction, and also a way to reschedule or update that appointment. This is highly configurable, where you can actually add other materials like educational resources or other links, so the employee or the patient can actually review before showing up for the appointment. Or if they want to change an appointment or update an appointment, they click up here, and that will allow you to make an appointment. So remember, this is exactly the same portal that I was showing you on my laptop. Now this portal is accessible, and now it's also mobile friendly. So I can make a schedule, I can make a cancel, and I can go through a different step of the process. Now, if I go back into a vaccine administration view, and I want to cover where, so as a vaccine administrator, I can open up my mobile phone app, a Power app, which is available both on iPhone and also Android. I can see all of the different clinics I'm associated with. And for example, if I'm working on Airedale Clinic or Airedale Mobile Clinic today, so I click on Airedale Clinic, it will show me all of the appointments which are associated with Airedale Clinic, right? I can search on the confirmation number, I can search on patient, I can search on date and time. I can also do a scan QR code, so if the employee came with a printed or shows up on the phone, I can see that information and automatically scan and deliver and automatically select the individual patient that we are working with. So now you can see that it picked up, based on the QR code, a patient information, their confirmation number, the date of birth, the street, the state, and all of the details. You can also check the comorbidity status. You can update the, if you want to, for example, check in this particular employee, put a notes, employees ready, for example, so you can have some notes and submit this information. So next thing you will see is, as you submit the information, it will still show you all of the questions that you have actually filled in earlier. If you work in healthcare, or if all of the questions you have filled earlier is available here too. And this way, whatever employee or the patient has reported the information, the person who is administering will have access to that information. As I click next, again, this is the stage where you either are administering the vaccination already, or you have picked up the serial to administer the vaccine. And the way we typically do is that we just scan for example, I'm going to scan this serial number, and the serial number gets sent. If you already have a QR code, then we can also select the manufacturer and other information. Since I have a serial barcode, where you can define if it's a first dose or a second dose. Within each vial, you can do 5 doses, so you can define this one as the third dose from the existing one. Serial number, you can pick up the manufacturer, you can pick up the manufacturer information, So for example, in our case, it was Pfizer. We can also define what will be the administration route, and it's really up to in your configuration that which route is related. At this moment, patient can also decide to kind of reject this vaccination, and in that case, you can take a note of what is the reason of refusal. So you have the capability to configure your own workflow as you work through. And once you have provided all the information, then you can do and submit the information and move on to the next vaccination. So you can clearly see that instead of filling up a lot of the information, you can really scan the patient appointment. You can scan the barcode or so you can track the serial number or batch number and do all of the details from here. I'm going to move back to my demo now towards the web. Microsoft Power App Platform allows you to have a core dashboarding capability within the platform. So far, I have shown you how Power Portal works, how the portal will allow employee to register. I've shown you that how through the mobile app you will be able to track and administer the appointment. This is kind of the command center view where all the configurations and details are available. There are multiple dashboard capability available where you can see all of the employees or patient in which phases they are in, what kind of risk category they are in, how many no-shows, how many different slots are available, by department, how many employees are already vaccinated, how many are in the process. So you have a lot of those capability built into the product. You can also track the providers, the manufacturers, the suppliers. You can track patients' vaccination type. This is based on which vaccination and what is the minimum and the maximum days for the first and second dose. You can actually track this information, and each drug can have a different consent message associated with it. Similarly, you can define different phases. What will be the start date? What will be the end date? Which phase is the parent phase? Which phase is the child phase? So you can create a complete structure defining it. You also have the capability to see a complete understanding of each patient. So if I picked up, for example, Ellison as my patient, you will see the detailed information about this. You'll see the detailed information about Ellison in the contact file, where you will be able to have some basic demographic information, the phone numbers and others, but you will also have the information about the primary practitioner, the high risk, the COVID-19 immunization, that if it's partial, complete. And the idea is that if you have only one dose, you're partial. If you have multiple doses, you're complete. If you haven't done anything, you're not start. You can define them in a phase. You can notify that if they have a missed vaccination appointment, if they have any results has been posted, if they have refused, what were the reasons for refusal. If they were a walk-in, you can track walk-ins too. And you can also track some insurance information so you can pass on to your revenue cycle system as is required. You can track their work profiles, which location, department, roles, so you can prioritize which employees should get vaccinated at what time, so you don't end up having all of the nurses, ICU nurses, scheduled for the appointment at the same time. You can see if they have done any rescheduling of assignment, if they have submitted any assessments, if they have shown any reaction, and you can track if they have submitted any reaction into the system. You can see which vaccination, which serial number they get administered. So it's really 360 view about the employee or the patient who get vaccinated, and you will have a lot of capability to report all that information back to your state registries. The appointment slot creation or appointment generation process is very simple. For each of the clinic, you can define that, hey, for this clinic, for 10 minutes interval, we are going to have for one station from 8 a.m. to 11:30, from this date to that date, we're going to work, across the board to make sure that we can have 100 vaccination get administered. So you can create the whole time, but the way you have to envision creating, you can create many slots, but it will only give you vaccination, or it will only allow you to make an appointment for total 100, because that's the maximum vaccination you have. So you can track through that. Similarly, there is a basic vaccination receiving process where you can define that I have received 500 vaccination on this date at this location, and you will be able to kind of capture that even though that you have ordered 500, you may actually have received 492, and that can create a flow for you to create a notification to wait list. So if there are employees who are waiting in the note list, as you have received more kit, they will automatically get an email so they can make an appointment and go from there. So that kind of is the built-in capability available for you to work through to make sure that as different scenarios are changing within the CDC guidelines, within the state guidelines, you can configure the solution based on that. Similarly, for each of the assessments, eligibility assessment or reaction assessment, you can define what those assessments are going to be, what questions you are going to end, and then for each assessment, for each location, what phases these individuals are going to select in. Similarly, you can define the full risk or reaction assessment, where you can go and ask deeper question: what was the date of adverse event, what was the severity of reaction, treatment, outcome, and everything around it. So again, very highly configurable system, allows you to make sure that you are able to change as the CDC, as the state and other guidelines change. Now I'm going to move into the next workload, which is specific to vaccine tracking. If I go into what we call track and trace, and the idea of track and trace is that as you receive any package through this mobile app, you can scan and you can keep the manifest, whether you're moving them, receiving it and keeping it within your inventory, or you are having that moving to a different vehicle and transferring it to a different location. You can track whether the temperature is ambient, whether the it's in transit, for how long it was in transit, when did it arrive. So all of that detail with the storage type, it lets you create. And based on the storage type, remember, it will let you automatically default what the expiration time is. So if it's in a cold chain, the expiry remains same. The moment you change it to an ambient temperature, then the expiry get updated, and you can prioritize the vaccination, which are to make sure that you don't have any expired vaccination in your location. So that's pretty much what we needed to cover from the demo standpoint. The final touch points we want to add: as we are collecting a lot of this data, we are able to produce many different templates to ensure that you can see, or your organization can see, one big picture around how many people you are targeting to vaccinate, how many confirmed cases in your region, how many people are eligible. If there are deaths, are reducing, then it shows that information. How many recovered cases. So it takes data from different places and can show you what is your target population, how much is already vaccinated, how much is the adverse reaction by the map level. So that's kind of a command center template that we offer as part of the implementation. But we have seen many organizations are taking the data from us and kind of push it into their existing COVID-19 platform, and we can certainly do that. This is built on a technology stack of Microsoft Cloud for Healthcare. We are using common data model to make sure that we can deliver all of the functionality which we have gone through earlier. We also have built-in integration with platforms like Cerner or platforms like Epic, where we support both HL7 through your health exchange, or we also support Fire connectors to make sure that we can bring data back into the Microsoft Dynamics platform. We are also working on Epic integration, so it automatically allows you to push and pull data to Epic. We have streamlined our deployment process, so everything in the beginning for vaccination appointment, scheduling and administering, all of that functionality could be deployed within 3 to 5 days time period, right? All we need is to make sure that we have access to the DevTest production instance of the Power Platform. We kind of deliver the Power Automate, Power App portals, and then configure the system, provide you the training, and go live with the application platform. This is our team, which we call MazikGlobal COVID-19 Solution Task Force. We have industry expert like Pat Becker, who is our Chief Strategy Officer. She has been an ex-CIO for University of Health System Consortium for over 25 years. And before joining Mazik, we also have Suresh Krishnan, who is our Chief Technology Officer, and he is also an ex-CTU and CSO for Northwest Community Healthcare for a long period. And then we have John Bodler, our Senior Director for Professional Services, who is leading all of our COVID-19 engagements.